Magnesium is the kind of mineral that doesn't ask for attention, but quietly holds the whole show together. It's like the backstage technician of human physiology, never in the spotlight, but without it, everything falls apart. And while it's long been celebrated for calming nerves and preventing muscle cramps, magnesium's real magic lies deeper. In its ability to dial down systemic inflammation, fine-tune cardiovascular function, and, according to growing research, lower the risk of early death. Not bad for something that also happens to hang out in leafy greens, almonds, and the occasional square of dark chocolate. One of magnesium's standout moves is its influence on C-reactive protein, CRP, the gold standard blood marker for inflammation. Elevated CRP isn't just a sign your immune system is grumpy, it's a loud, red flag signal for increased cardiovascular risk, insulin resistance, and even all-cause mortality. Several studies have shown that people with higher magnesium intake tend to have significantly lower CRP levels. This isn't just correlation with a side of kale, there's causation brewing here. Magnesium appears to suppress pro-inflammatory cytokines and reduce the activity of nuclear factor kappa B, NF-B, a molecular instigator of chronic inflammation. In other words, it helps your body chill out at the cellular level. Nowhere is this anti-inflammatory effect more valuable than in the context of metabolic syndrome, that cluster of unfortunate traits like abdominal obesity, high blood pressure, elevated blood sugar, and low HDL that tend to hang out together and invite chronic disease to the party. Magnesium intake is inversely associated with the risk of developing metabolic syndrome, and this seems to hold true across diverse populations and age groups. Part of this comes down to improved insulin sensitivity. Magnesium is required for the function of insulin receptors and glucose transport. When magnesium is low, your cells become more insulin resistant, your pancreas has to work harder, and glucose starts overstaying its welcome in your bloodstream. It's a metabolic spiral, and magnesium is often the quiet hero that can interrupt it. Blood pressure is another place where magnesium flexes its cardiovascular credentials. It acts as a natural calcium channel blocker, relaxing the smooth muscle in blood vessels and promoting vasodilation. This means less vascular resistance, lower systolic pressure, and less strain on the heart. Multiple meta-analyses of randomized trials have confirmed that supplemental magnesium, usually at doses around 300 to 400 milligrams per day, can lead to modest but clinically meaningful reductions in both systolic and diastolic blood pressure. This effect is even more pronounced in people who are magnesium deficient to begin with, which, spoiler alert, includes a large portion of the population. In fact, magnesium deficiency is incredibly common, despite its abundance in whole foods. Modern diets high in refined grains, added sugars, and processed fats often fall short of magnesium-rich foods like legumes, nuts, and dark leafy greens. Factor in soil depletion, chronic stress, alcohol use, certain medications like diuretics and proton pump inhibitors, and you've got a recipe for widespread subclinical magnesium insufficiency. And when your cells don't have enough magnesium to regulate oxidative stress, inflammation, and endothelial function, the damage accumulates slowly but surely, raising your risk for type 2 diabetes, stroke, arrhythmias, and yes, premature death. But here's the good news. The fix is shockingly simple. A few dietary shifts, a handful of pumpkin seeds here, some spinach there, and you can raise magnesium intake with delicious efficiency. And when that's not enough, supplemental magnesium, particularly well-absorbed forms like magnesium glycinate, citrate, or malate, can help restore balance. For most adults, aiming for 300 to 400 milligrams per day from all sources is a solid target, though some may need more based on health status and individual absorption. What's especially fascinating is how magnesium doesn't just lower disease risk, it seems to promote resilience. It doesn't merely suppress inflammation, it helps regulate the immune response. It doesn't just lower blood pressure, it helps the cardiovascular system adapt to stress more effectively. It's less about preventing a single disease and more about improving the terrain, making your body a less hospitable place for chronic disease to take root. That's why studies consistently show that higher magnesium intake is associated with lower all-cause mortality. You don't just live better, you may live longer. In the era of complex, high-tech interventions and personalized health algorithms, magnesium remains refreshingly simple. It's accessible, affordable, and evidence-based. If there were a mineral with a resume designed to lower inflammation, support metabolic health, and reduce the risk of early death, Magnesium would ace the interview without even loosening its tie. So go ahead, toss some sunflower seeds on your salad, drink that magnesium-rich mineral water, and maybe even treat yourself to that piece of dark chocolate. Your mitochondria, your blood vessels, and your inflammatory markers just might thank you by letting you stick around a little longer and feel a lot better while you're here.